One of the common things that we do in our field is tonsillectomy. And tonsillectomy in the past used to be done primarily for strep infections. And in the olden days, a lot of people had their tonsils out routinely. These days we're more selective in who gets their tonsils out, and we do it more often than not for sleep problems. So if a kid comes in and they're snoring a lot, it's disrupting their sleep. Sometimes if we'll see pauses in the breathing, we're suspicious of a condition called sleep apnea. When kids stop breathing while they're sleeping, they don't get good restful sleep, and in removing the tonsils will frequently restore good normal sleep for these kids. A lot of times the adults will have problems with chronic sore throats or little tonsil stones that will come out of the throat and from the tonsils themselves, and frequently adults will have their tonsils taken out for chronic tonsillitis issues, and that may include strep throat, chronic sore throat, bad breath, things like that. Oftentimes when we're doing a tonsillectomy, we'll take out the tonsils and the adenoids. They're very similar tissue in different locations of the throat. There are a lot of different ways to take out the tonsils, but the most commonly used technique these days is coblation and electrocautery. Coblation takes out the tonsils with a little bit lower heat and less bleeding during the procedure. The standard treatment for many years was electrocautery. They're both safe and effective treatments for tonsillectomy. After tonsillectomy, the recovery time is variable. The kids oftentimes heal up faster, and within 7 to 10 days, they're back to themselves. Adults take a little bit longer to heal up. It's oftentimes 10 to 14 days in the recovery.